I'd like to now introduce our first speaker, Fiona Dalton, who is the Trust's Chief Executive. Fiona's no stranger to the hospital because she was the Strategy Director a few years ago. And like a number of us, she was lured away to the bright lights of Great Ormond Street and London. But I'm pleased to say she learnt the error of her ways, and she's here to join us today. So, Fiona, over to you.
So my name's Fiona Dalton. I have the honour of being Chief Executive of this hospital, and I just wanted to first of all say welcome and thanks so much for being here today. I'm sorry that we started late. The reason, apart from some technology glitches as well, is that we had our paediatric cardiac surgery weekly conference in here this morning, and it's where they teleconference with Oxford. We had 6 new cases that Oxford brought today to talk about at that conference, and these are children who now come from as far away as Milton Keynes and Northampton to have their surgery here. So for the 6 families whose lives in the last week have just changed forever, but for us there's an indication. I just want to give it you as an example of how technology can really change how we do things, and how actually our catchment area and the amount of work that we do across the country is really increasing. We're here for our patients, and that's the only reason we're here as a hospital, but those are our patients now, but also our patients of the future, and that's why we do research and that's why we do education, to ensure that our patients of the future get better treatment and have people here, trained staff, ready to treat them. And we think that we are here for our patients of now and the future best by engaging and innovating. And so that's why we're here, and that's why we've invited you. So thank you for being here. So this is a quote from our 2020 vision, which was written about 7 years ago, and has actually amazingly still feels relevant and still unites people in the Trust. And I think it unites people because of the level of ambition. This is a really ambitious place, and to say to people what we're going to do at a world-class level is really powerful, and that's people across the Trust really buy into that. It's underpinned by the sustainability of the teaching hospital model, and calling ourselves a teaching hospital I think doesn't really often translate outside the NHS. You know, why would you want to be in a teaching hospital? But what it really means is there's a triumvirate of what we do. So we provide clinical care to the best standard that we can, and we're big enough to provide a lot of specialist services. But we also do clinical research, and we also teach particularly the doctors and nurses and the other health professionals of the future. And the combination of doing those 3 things is really powerful, because what it means is we get really clever people here, and you're going to meet some of those really clever people later today who are going to talk. And those people are interested in not only providing clinical care, but also constantly thinking, actually, how could we do this a bit better? So what could we change so that tomorrow we're better than we were yesterday? And what it also means is that we've got the bright, clever people of the future who are here being taught and being trained. And as I'm sure everyone knows, when you train people and they're good people, not only is it work because you're teaching them, but actually it's helpful and it sparks you to think differently and to be better, because they will ask the questions of, so why are we doing it like that? And that's why the teaching hospital model really works, and it's why a lot of the really good people across the UK and across the world want to work in these kind of institutions. So in terms of our scale, I think I'm not going to read out all these numbers obviously, but there's only one message, which is actually we're really big. We are one of the biggest hospitals outside of London in the UK. Patients come to us from across the south of England, from Brighton to Truro, from Northampton, Newbury, Bath. We've now got a helipad. People can come in by helicopter to avoid the car park. You have to be pretty sick though, or a real celeb. So we're growing very rapidly. That's in terms of our clinical service. In terms of our research, we're the 6th highest recruiting trust for patients into clinical trials in England. In terms of the infrastructure that supports this, we are one of the biggest employers in Southampton. So in terms of our employees and our university staff and students, I did do a quick Google about, that's a sizable town, isn't it? And Google told me that was about the size of Wootton Bassett. But actually, once I'd done that, I sort of thought, I missed a trick there, because we've also got 1,000 inpatients at any one time. We've got several thousand outpatients here every day, and we've got all the visitors as well, and family. So we are actually a really big town that operates here every day, 24 hours a day, 7 days a week. So that's all just a scale of numbers, but it can be slightly meaningless, and I want to talk a little bit about what it means for the individual patients here and in the future. So first of all, it means you've got much more chance of coming here than you used to. So we're treating, as of now, 6.4% more elective patients and 5.3% more emergency patients than we did a year ago. And that's a fairly consistent trend. Each year we consistently treat many more patients than we did before. And that's for a number of reasons. There's a big international trend towards centralisation and specialisation. And the UK is part of that. That increasingly the technology and the complexity of what you can do means that patients are coming more and more to specialised centres. At the same time as we are moving some treatment right out into the community and into people's homes where we can do that. It also means it's also about demography. You know, we've got more older people in the population. We've also got more children in this population, and the more that we can do, the more that we keep people alive longer. And so we kind of are self-sustaining in terms of growing and doing more and more. So we're building a lot to try to support this. We're in the process of building 70 more inpatient beds here at the minute. We're also building a children's hospital, which is next to the emergency department, and the first phase of that, which will be open later this year, is our children's emergency department. And next to that, in a partnership with Ronald McDonald Charities, the Ronald McDonald Parents Accommodation. That Ronald McDonald House is one of the biggest in the country, and that's simply because Ronald McDonald have done their calculations on how big it needs to be, and the scale of our children's services are such that that's how big it needs to be. So it gives us an indication of how many specialist children's services we do here. And that children's hospital will be, I believe, the most all-encompassing children's hospital in the country in terms of what we do through emergency services, general services and specialist services in one building, with the benefits of being a real children's hospital, but all the strengths of also being attached to a really big adults hospital. So it means you're more likely to come here as an individual patient, you're more likely to get some really innovative treatment. I don't have time to talk about all the new things that are happening, but just to mention a few in terms of how we have changed the emergency surgery pathway over the past year, so that you are more likely to get treated really quickly, to get home, to not wait around, and to get sorted by people who are specialists in emergency surgery. In terms of some of the interventional radiology that we now do for cancer treatment, which is image-guided surgery, where we are really leading the country. In terms of some of the ophthalmology that we do, that you are much more likely to keep your sight than you ever were before. And we've got a number of areas where we can actually demonstrate that in outcomes. So for instance, if you come in here with a stroke, you're more likely than almost anywhere else in the country, 56 days later, to be back at home. Not in a nursing home, not in a rest home, not in another hospital, but back where almost everyone wants to be at home. I mentioned the helipad in terms of major trauma. This is a really good example of centralisation, and we are a major trauma centre, as are several other hospitals around the country. Across the country, you, as a member of the UK population, are now 20% more likely to survive if you have a major trauma than you were 2 years ago. Just this morning, there was a road traffic accident near here. We had 4 critically injured patients come in from that one accident. And we're now at a scale where you can imagine the kind of infrastructure that you need to deal with 4 critically injured people coming in at one time. And that's what a major trauma centre is about. You're also much more likely to be in a research trial if you come in here. And all the international evidence is that if you're a patient in a research trial, you get better treatment, you get right at a cutting edge and the innovation of where we think the best possible treatment is. And you're also more likely to be in a teaching and a learning environment. And as I said before, that's good for everyone. But we absolutely don't do all of this on our own. And one of the things that we have to really focus on is building relationships. So in terms of our clinical care, some of the relationships that we've got, so we've had a relationship with a private sector organisation who takes our patients out when they still need some care but don't need to be in an acute hospital, and actually provides care for us in the patient's home for the last few days, so that we can get patients home quicker and therefore we can get more patients in to get treated in this really expensive building that we have here. We work with our local NHS partners, and the building that you might have seen in the courtyard as you came up is for the community elderly care team to work, so that when elderly patients come into the emergency department, if they really medically don't need to be in the hospital, there's a team there who can help quickly sort things out, so that if they need some more help at home, some temporary support, they can do that, so that they don't get sucked into a hospital, which we know is the last thing which you would want for an elderly relative. We've got a really good radiology partnership with Siemens. Really happy to see Siemens out there in terms of that which is transforming our imaging capability, particularly this year. And the third sector, so we've got really strong partnerships with Marie Curie, with Macmillan, with our Teenage Cancer Trust. We're really open to working with these different organisations from every sector. In terms of research, we've obviously got our unique partnership with the University of Southampton. They are absolutely as one with us, and we are with them. And I know that Christine's going to talk later about R&D, so I'm not going to talk about the Wessex Investigational Sciences Hub, our clinical research facility, our biomedical research, our Life Lab, how we work with the MRC and the Wellcome Trust, because Christine will talk about this with much more knowledge. But finally, an education. Obviously, we work with the two universities in Southampton. Our values-based recruitment process for nurses, for student nurses working with the university here, has been nationally accredited. And on the anniversary of the Francis report, I think it is worth noting that everyone across the country is saying Southampton are doing it right in terms of recruiting people who have the right values to be health professionals of the future. And our work with Solent University is also really innovative in terms of how we take local people who often haven't had the chance of a formal education and support them through work to the extent that they then can go through different development grades and actually get, if they want to, skip the first year of a formal nurse education, because we've trained them up on the job. So it's a way of really helping local people get to where they deserve to be. And then finally, the infrastructure for all of this. It is a really busy site. We've already talked about car parking, but we are working to select a commercial partner to work with us on all of those kind of infrastructure things. The main entrance, I'd personally really like for us to change some of the occupants of the main entrance, and sort out the car parking and some of those other things that actually make a real difference to our patients. We've also got some really interesting ideas about what we could do on this site in terms of, for instance, patient hotels, different ways of treating people. And what I really like about the culture here, and the reason that I did want to come back, is that actually people here are all up for doing something new. And then finally, our most important relationship is with our patients. Internationally, I think every healthcare system is trying to say, how can we work with patients more in partnership, not just telling patients what to do, doing things to them, but really using them as a partner in terms of, right, here's what we could do, here's what you can do, what are we trying to achieve here? We've got some really interesting stuff going on around that. And some of the IT developments in terms of really allowing patients to actually have access to their own records and be in a bit more control of their healthcare, I think is really exciting. This is all I really wanted to say. I think I decided that my job this morning was to hopefully make you feel a little bit curious and want to stay and want to hear what everyone else has got to say. The words that I wanted to leave you with, I guess, which I think are at the heart of what we do here, are something about the size, the large scale, that we have got the critical mass to do things properly, and that we can do things at scale in terms of our population of people here and patients and population. That we're practical, that we're not an ivory tower, that we actually want to change things that make a difference and actually do them on the ground. That we are innovative, that we are up for building relationships, and we've got a good track record of that. And that we're genuinely open to feedback and new ideas, and that's from our patients, but also from partners across every sector. And so we are really here and interested in hearing your ideas and seeing how we could do things differently. Thank you.